the thoracolumbar fascia can be one of the major sources of pain in the low back pain. So you remember yesterday that we showed you the approach for the tissues all around the sacroiliac area and the lower lumbar area. Okay, you can also work this on all the lumbar area. If you want to work specifically on the lumbar area, you can start from the lower thoracic area going down to the pelvis, or moving from the pelvis up to the lower thoracic area. So approaching also your patient at the beginning with some soft tissue action can be very useful for allow you a better application, better performance of the technique. Okay. You can be general, so as you said yesterday, with a general approach with the palm of your hands, or you can also go like more specific action with your thumbs, or also with the fingers. Okay, and this can be an action not just on the tissues. Okay, so not just the soft tissue, so all the muscle, all the thoracolumbar fascia, but also an action like a springing action to feel also the resistance on the spine. Okay, so it can be like a posterior anterior action, okay, or transverse action, rotation, okay, and finding out the resistance, okay, at which level is and in which motion is, okay. It can be useful, so it's a test, but also a way to address technique. And it's impossible to separate the action on the tissue, the soft tissue, and on the joint, because every input you give at the tissue, the soft tissue arrives also at the joint as more as you apply the pressure. Okay, and also not just joint, but also the disc, the vertebral disc. So it's impossible to say, okay, I'm acting only on the joint, I'm acting only on the disc, I'm acting only on the soft tissue. It's always a matter of working on the quadrant of the tissue that are surrounding this big area. A general action with the palm of your hands. Okay. Apply this transverse and diagonal pressure. Okay. Or this can be done with a combined action through both of your hands. One hand gently wrap the anterior part of the pelvis. Okay. The other hand is in contact, the palm of your hand is in contact with all the tissue on the opposite side to your position, okay, of the spine. So, and the movement is a well-coordinated movement between the left hand and the right hand. So, movement is this, so pulling the pelvis towards you, okay, and the right hand pushing down toward the back. And you can do this at different level. So lower spine, lumbar spine, in the middle part, and the upper part.
Pay attention also to Andrea's body mechanics. He's doing everything with his own body, not this. Okay?
So it's not, as Paul said, it's not this. Okay, but I'm moving backward, so I'm pulling the pelvis, okay, and I'm leaning back on his body. So I can take one hand and use the other. Okay. And this action can go simply on the tissue, soft tissue, if your pressure is not too deep, okay. You can go to a deeper tissues, arriving on the spine, or you can act more on the spine by improving the pressure that you apply. Okay. But again, the action is always like on all the quadrant from the top layer to the more deeper layers. Okay.